Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about loose teeth. Loose teeth situations are not exclusively related to kids or newborn babies that have their milk teeth fall out. These types of difficulties might as well appear in older people. Loose teeth could potentially cause shame, discomfort and pain if they are not treated for an extensive period of time. The tooth which have turned into loosened could possibly result in permanent tooth loss in the event that the tooth issue is not noticed and also cured successfully by a dental surgeon in good time. In case the loose tooth is not from a trauma, in that case it's probably a result of periodontal condition. This is most definitely accurate, obviously, in older people. Loose teeth in children around the age of 5 teeth slowly fall out to create path for permanent grown-up teeth. Occasionally children get rid of milk teeth prematurely as a result of damage or perhaps similar reason, however this can cause the permanent tooth arriving prematurely and lead to gaping problems at a later date, therefore maintain brushing as well as flossing. Milk teeth typically fall out in the demand that new appear in. For that reason the bottom 2 teeth is going to be the very first to go away, accompanied by the top 2. There's almost no rhyme or a proper reason to the timing, nevertheless they usually will all be removed by age 13. Many children get thrilled regarding losing tooth, particularly if you're planning the tooth fairy path and also they've learned from some other children regarding discovering money under their pillows. Some others could be scared that losing a tooth are going to feel painful or perhaps that there is going to be blood loss. Losing milk teeth is a significantly less unpleasant experience compared to obtaining them in. However, it could be challenging, particularly if a loose tooth appears to be dangling on for a long time. It's wise to allow the tooth get out by itself for the reason that milk teeth generally come out before the permanent tooth is able to appear. That's the principle, anyhow. It is not easy to go along with this strategy. Loose teeth in adults. Periodontal disease is an inflammatory problem as a result of a bacterial contamination. Periodontal disease is a low-quality, constant bacterial infection of the gums environment of your teeth. Bacterial oral plaque exists in your oral cavity and binds itself to the teeth. In the event that plenty of plaque accumulates under your periodontal and stays for enough time, a disease are going to develop. In case a periodontal condition is neglected, the gums along with the adjoining bone construction that hold the teeth can easily destabilize and develop into damaged, allowing the tooth to be loose, and also at some point tooth will fall out. Tooth accidents and injuries as a result of falls, taking part in sports activities, or perhaps additional damage may cause tooth to get loosened from their sockets. The pressure aimed to the oral cavity or teeth region could be sufficient to completely knock off teeth, occasionally. Honestly speaking, if an individual with loose tooth doesn't modify their direction, their teeth are likely to fall out of their oral cavity. Looseness of tooth is the consequence of occlusal damage that may virtually destroy the rest of the periodontal compositions of the teeth, and it will come in a couple of variations. First, occlusal damage is once an excessive pressure is employed on typical periodontal compositions that could be generally a result of parafunctional pressures, for example clenching or perhaps grinding behavior patterns. Secondary occlusal damage is once regular biting pressure is employed on a tooth which has missing important bone assistance or periodontal connection. Teeth grinding may also lead to the progression of loose teeth with extreme atypical tension. Loose teeth issues have to be treated by dental surgeon to make sure that these types of difficulties have no opportunity to grow into more complex tooth conditions. Loose teeth treatment. If the condition is progressed, a surgical flap method might be required to properly cure the gums. Teeth which are extremely loose will have to be taken out, that will after that be restored by dental implants, attached bridge work, or perhaps detachable full or limited dentures. The long-run outlook or projection of the teeth has to be taken into consideration before selecting treatment methods. Despite the fact that short-term splinting solutions may possibly get you enough time, The teeth would have to be restored in case the injury to the periodontal compositions is extreme. See your dental professional or perhaps a periodontist for a detailed evaluation and examination to understand all your alternatives. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.